Erectile dysfunction is the inability to obtain and maintain an erection that is firm enough for penetration during sexual intercourse. Erectile dysfunction is an extremely common condition, and it is actually present through all age groups of men. However, as you get older, the incidence does increase. About 40% of men at age 40 suffer from erectile dysfunction, and this goes up to 70% of men at age 70. Erections are formed to be a complex mechanism that involves the brain, nervous system, vascular system, hormones, and then the penis itself. There can be issues with anything along these pathways that can lead to erectile dysfunction. The easiest way to think about erectile dysfunction is that for an erection, your blood needs to get to the penis, and then your blood needs to stay in the penis. So there can be an issue with the blood getting to the penis or with the blood leaking out of the penis. The best way to diagnose erectile dysfunction is through a careful history and physical. Listening to the patient, listening to their story, as the patient is the person who knows the best about what is going on. There are also other laboratory tests that may be ordered, such as testosterone, as that can lead to erectile dysfunction. And then lastly, sometimes we may obtain a penile Doppler or penile ultrasound to see exactly what is going on in the penis and to evaluate the blood flow into and out of the penis. The only thing that can be done to prevent ED is to live a healthy lifestyle. That means eating healthy, exercising. Anything that will promote heart health will also promote penile health. However, even with these precautions, many men will still have erectile dysfunction in their lifetime. There are several benefits to seeing a specialist as soon as you are diagnosed with erectile dysfunction. We are best able to treat you and best able to get you on a rehabilitation program to both stop the erectile dysfunction from getting worse and hopefully reverse some of the damage that has already been done. There are several treatments for erectile dysfunction. First, we have the pills such as Viagra and Cialis. These can work for mild cases of erectile dysfunction, but often won't work as the erectile dysfunction becomes more severe. They can often also have side effects such as facial flushing, headaches, or nasal congestion. Then we have the vacuum erection devices. We tend to use these more for penile rehabilitation. And then we have the penile injections, or also known as intracorporeal injections. This is where you actually inject medication directly into the penis to help blood flow into the penis and create an erection. And then lastly, we have the inflatable penile prosthesis, or the penile prosthesis surgery. And this is where we actually implant a device into the penis that will give you a very rigid erection. The only way to determine what treatment is right for an individual patient is to listen to the patient and take the entire situation into account. There is no one treatment that works for every single patient. Satisfaction rates for erectile dysfunction treatments vary across the board. The pills have satisfaction rates from anywhere from 50% to the mid-60s%. The injections are even lower, often in the 40% of patients that are happy with these, and more than half of patients that start penile injections do not continue on with penile injection therapy. The penile implant, on the other hand, actually has very high satisfaction rates, often quoted as up to 98% in studies. Surprisingly, there are actually real long-term consequences of not having erections and not being treated for your erectile dysfunction. Oftentimes, men will see penile shortening and penile scar tissue, and this can result in worsening erections and just shrinking of the penis. This can be prevented if you're started on an appropriate regimen for your erectile dysfunction, and if you seek treatment from a specialist as soon as you are diagnosed.